Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome to Smile Sisters.
Hello.
Today we want to talk about selfies. Selfies is a big thing these days, especially with a younger generation than us, because we're almost 50.
Right.
And I think people maybe from teens to like 20s and early 30s.
In the 30s, yeah.
Yeah. It's a big deal to take selfies.
Well, it's like societal expectations, you know, and the issues that people come in wanting to correct these days have changed a little bit.
Yeah.
And like you said, some of this has to do with how much we're staring at ourselves.
Right.
People, take so many photos of themselves and they're posting photos of themselves on social media.
Constantly.
And then Zoom meetings.
Right.
You know, when you're in a Zoom meeting, you're looking at yourself.
You're looking at yourself, not the person speaking.
Potentially. But I mean, there's an image of yourself on
Yeah.
the screen
No,
the
for
entire
sure.
time, a video of yourself. And it didn't used to be like that when you had regular meetings,
Right.
So people have so many more opportunities now to criticize themselves.
Exactly. It's a lot. Like when I was growing up and when we were growing up, you would look at yourself in the mirror in the morning.
And that was it.
And that was like probably the only time you saw yourself. Maybe in the bathroom in another mirror, but you would like see yourself maybe once or twice per day. But I feel like now people are constantly staring at an image of themselves. So a lot of people come in with teeth that are not perfectly lined up from different angles. Like if you run straight forward, it looks okay. But if there's a photo that's from their right or their left, like one tooth is not quite lined up. And that bothers people.
Yes, people really analyze themselves from every angle.
Yeah, they do.
And photograph it. And,
Yes.
we have patients all the time. I have patients, young patients, who come here for cosmetic consults. And I encourage people to show me photos of what they want. Because our main goal here, my main goal with a cosmetic makeover or whatever, is to understand what the patient wants.
Right.
To be able to realize what that is and then be able to tell them, yes, I can reproduce that, I can make that happen, or that's not realistic, or that's not viable in your mouth, as in like it's going to break off or something.
Right.
And so I encourage people to show me photos, but sometimes they show me their camera reel and it's like thousands of photos of themselves.
Right.
And, thousands of selfies that they've taken. So it gives me an idea that people are obsessing over how
Over
they
all
look.
their flaws constantly.
Yeah, and it's a bit of a shame, honestly.
Because most of them are gorgeous.
I actually had
They're
a
young
patient
and beautiful.
yesterday. A beautiful patient drove down from the Bay Area for cosmetic work, and I couldn't quite figure out, just talking to her on a video call, which is what we do first, what her main concern was. And when she came in, I could kind of see it, but really, her teeth are beautiful, and she says, people keep telling me I don't need any work done, I'm fine, but this bothers me, that bothers me. And that's a good thing to look at. If somebody tells me, I don't like smiling, it makes me uncomfortable to smile, I'm not confident, then I need to put aside my, sort of
Right. Like what you
judgment
think.
on their smile.
Yeah.
It's about
You
it's
need
about
to
you.
do what they want to do.
So that brings us back to this point. A cosmetic makeover is about you.
That's right.
And your goals. So sometimes people will say to me, I don't know, doc, what do you think I should do?
Right.
I'm like, well, this is purely elective. Now, sometimes it's not. Sometimes it has to do with their bite or whatever, and we need to correct that. But often it's a purely cosmetic thing, and that is totally about you.
Right.
You know?
Like there's no medical reason for it other than for you to look better. So it's basically 100% your decision. It's not about what do you think, doc? It's about, no, what do you want? It's like a totally different conversation.
Yes, it is. But
Yeah.
it opens doors for people. So sometimes we do these smile makeovers, and people then come and tell me, oh, I found a partner, I found a new job, I got a promotion. And it's only because now people feel comfortable smiling and looking you in the face when they're talking to you,
Right,
whereas
right.
before maybe they were ashamed and they wouldn't do that. So even though it is, a superficial thing that you do, but it can have a real effect on your life if that's really what's holding you back. Sometimes people just need that one push, that one thing to make them feel better, and then they kind of propel themselves forward. So that's really cool to see, and we see it over and over again.
Right.
We just finished Invisalign on a patient yesterday, and I gave her retainers yesterday, and she goes, "This has changed my life." All we did is straighten some of her teeth, and they were not like terrible at the beginning, but to her they really were. And just straightening that out, she goes, "It's totally changed everything. I feel so comfortable smiling.
Right.
It's just changed my outlook."
I had a
So
patient
cool to
too,
see.
same kind of thing, like a tiny little space at the gum line between two teeth, which on a normal level is totally invisible, but she could see it in certain photos, like
Yes.
not even like in every photo, but just certain photos. And just for that, we did like a few months of Invisalign, and we like turned the tooth so that little gap would close, and she was like ecstatic.
Yes.
It's such a minor thing, but people, because people are looking at themselves so much, all these minor things are becoming like not minor.
Exactly.
And people care to fix like even tiny things. So all this to say that even a tiny little change is fixable, is doable.
Yes.
And it can make a huge difference.
And a cosmetic makeover, on that note, can be a range of things. It can be from just twisting a little tooth a bit,
Right.
to just getting whitening, to just getting a good deep cleaning,
Right.
right? If your gums are healthy, your teeth will look better. They're like the window dressing to your teeth, right? To doing, just a little bit of composite bonding, to doing full-on, veneers. All of those things, or a combination of them, can be a cosmetic makeover. So one of the warnings I would give is, if you're going out there, sometimes some cosmetic dentists will just be like, "Well, we're going to do 12 upper and 12 lower veneers." And why? Is that really necessary? And
Right.
very few people is that really necessary. And
Right,
that's if
right.
you have a genetic condition where all your teeth are dark. But that's a rare condition as well. And you don't necessarily need to go 12 teeth back as well.
Right.
So be careful that you don't get over-treated. I do a range of things, but I'm always trying to find the least thing that we can do to achieve your goals and get you the cosmetic result that you want. And it might be
Right.
just twisting a tooth a little
Right. I mean, like for that patient, I think she had been told to get a bunch of veneers
Sure.
to close that space. But it was really, we're talking like less than a millimeter, like if you can visualize that, of just, space between the two teeth at the gum line. It's so minor, but because she was noticing it and she had gone to other dentists and they had suggested veneering all the upper teeth, and it was just a simple few months of Invisalign and it was
Yes.
done. So it's very interesting, and psychologically I think our society is going into this level of self kind of like analysis and looking at ourselves constantly, and so we're noticing these tiny things, but it's fixable and it's doable.
It is. And sometimes I tell patients, or if we do something and they've got the mirror right up to their face and they're like, "When I look at it from this and I see, okay, but maybe you should just like let that go, Like we don't need to fix that necessarily. I think it's okay. And sometimes I try to encourage patients to just let it go and be like, go home and then come back if you still feel that way in 2 weeks,
And then there's some patients that it's like they've had 10 sets of veneers and they're still not happy.
Well, you have to, exactly, to understand what the patient wants and be able to, and after years of doing this, I have realized this, right, through having situations where at the very beginning when I started doing this, where I would be like this and they'd be like, "That's not what I wanted at all," And so very quickly I learned, no, the biggest thing I need to do here is figure out what the patient wants.
Right.
And so we do smile designs and trial smiles for that reason. When we do cosmetic work, even when we do Invisalign, we do a digital setup of the teeth and show our patients, okay, here's how we're gonna move your teeth. It's a cosmetic situation, so they can see what their teeth will look like. after we've moved them.
Right.
But with veneers and stuff, we do a trial smile, we design it, and you come in and we can put it over your teeth with temporary material. So we can literally see in your mouth
What it's going to look like.
And sometimes patients think they want something, but it doesn't suit their face. It
Right.
doesn't suit their smile, the shape of their face, their age, things like that.
After they see it in their mouth, it's not what they wanted.
Yeah, so now I just kind of do what I think is going to work, as well as listen to what they're saying, so we can get a result that's cohesive, that's going to fit their face, also going to meet their goals.
Right.
So yeah, what our points here are,
Points are minor changes can make a difference.
you don't have to do the full 12 upper,
That's
12
right.
lower.
You can be very conservative and still achieve what you want, especially if you know exactly what you want.
Yes.
So it's harder for us to get a good result when you don't know what you want, and because the range can be so variable. But if you come in knowing exactly what you want, it's like 99% achievable to get there.
It is. Honestly, sometimes it's better. Like, I like for you to be picky, to be
Yeah.
like, this is exactly,
Yes.
because I can fully understand, yes, that's doable, and here's what, I can show it to you. But when you're like, I don't know, doc, maybe do this, maybe do that, then it becomes confusing. So
What
yes.
about that patient who came in because his wife had told him, you better fix your teeth?
And we did. And
He
he's-
didn't quite know what he wanted.
He's in his 70s.
Yeah.
Yes. He just, we actually did some veneers for him. No, he did want them,
Yeah.
He goes, my whole life, he has just some super dark front teeth, really dark, and a little bit so overlap, but not that bad, but very dark. And he said, my wife says, now it's time for you to do this. But
Right.
he'd been wanting to. He just hadn't done it for himself.
Right,
and she
right.
goes, you better prioritize yourself now.
And this is almost like the opposite spectrum of the younger generation who's staring at themselves all the time and who wants to fix every little thing. There's like a whole other generation, older generation, maybe mostly a male population, who are just like completely ignoring their cosmetic, selves, and because it's like, this is, who cares, like it doesn't matter, but it does,
And
it does.
after we did them, he goes, oh, I can smile now.
Yeah.
They push it back.
They push it back.
But, interestingly, I had a patient yesterday. He came for an Invisalign consult. His wife is our patient.
Right.
They sat in the chair. Actually, you saw him for the virtual consultation. And she was in the room with him. And his teeth are really splayed out. He needs Invisalign in a big way.
Right.
But when it came time for me to look in his mouth and he was going to open his mouth, he asked his wife to leave the room.
Right.
And I realized he didn't want her to see the situation in his mouth, his
Right.
own wife. So even though he was like, oh, whatever, I could see that he didn't feel comfortable.
Right.
And that's a big deal. Men might not express that to you, but you see in
And
their
he's
actions.
like, I would say like in his 50s or 60s.
Yes, he's in his 50s.
He's an older gentleman, and he's one of those people who is like very tough and very
seems that
manly,
way,
and
yes.
but like fixing teeth
And he
is
kind
like
of covers
not.
his teeth with his lip
Yeah.
when he talks.
Yeah.
So when I wanted to look in there, he asked her to leave.
Yeah.
So I realized,
it's
wow,
very
this is a really
vulnerable.
big deal for him, even though he's not expressing it.
Yeah, it's a very vulnerable thing.
Yeah.
Yeah. So I guess what do we want to conclude with?
Well, it doesn't matter how big or small your problem is in your mouth. It's about your perception of it.
Yes.
And that's really what we're trying to address. So if you're worried about something to the point where you can't let your spouse look in your mouth, or you don't feel comfortable smiling, and it's impeding your life.
Or if you always notice one little gap in a
bothers
certain
you.
picture that bothers you. So it can be from never smiling to a certain angle. So it can be a range of things, but
Yeah.
it's all fixable and it's all doable.
It is, and we're here for you, and we will listen to you and not judge you. We will try to encourage you to be minimalistic and to not be overly critical of yourself.
Yep.
Yeah.
Okay. Well,
Come see us if
Yeah.
you want to do a consultation. We do free virtual ones.
we do.
Go to ladentalclinic.com.
Okay. Bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.